Let's start with some of the updated information from today's numbers. You start with the cases. Cases 737. You can compare that to the 21-day average. Of course, the 21-day average is going up because the case numbers are going up. So we are seeing a continued increase in number of cases. The deaths, recording 11. Hospitalization, 65. So those are up a little bit of hospitalization today from the 21-day average. And ICU admissions are up slightly as well. So those are the key data. Let me talk a little bit more about the long-term trends in regard to hospitalizations. And hospitalization is a lagging indicator, obviously. Someone is infected, it takes a while, they get sick, go to the hospital. But last week is a significant week. From June 21 to June 27. It was the first week of increasing COVID-19 hospital utilization in the state for over 2 months. We have to go back since late April was the last time we had this much. So it's starting to go up slightly. The number of standard hospital beds occupied by COVID-19 positive patients peaked in late April and early May at about 1,000. They reached a low of 513 on June 20th. So June 20th was our low. Just last week, though, we had about 500 to 550 total COVID patients in Ohio's hospitals. Now, these numbers, of course, are not hospital admissions each day. These are just who's occupying these beds, which from a point of view of being concerned long-term about having the requisite space. So we keep track of how many go in each day, but we also keep track of what the hospital capacity is and how many are in the hospital. So again, last week we had about 500 to 550 total COVID patients in Ohio's hospitals. This week we're now at around 650. The ICU and ventilator utilization is still holding pretty steady, but we are seeing increases in those in some parts of the state. The increase in COVID hospital occupancy is most apparent in regions 2, 3, and 6, and that is Cleveland, that is Dayton, and Cincinnati, those regions. In other regions of the state, the COVID hospital occupancy had been declining, but now appears to have leveled off. In the Dayton and Cincinnati areas, the recent increase in hospital utilization does include standard beds as well as ICU beds and ventilators. Although COVID utilization in hospitals is increasing, I want to make it very clear, there's still adequate overall capacity available across Ohio. No region has reached a concern threshold of 80%, which is when the hospitals start getting concerned, of overall utilization for ICU beds. So we're not there. But we do know from lessons of recent history in New York City, Houston, Arizona, that this can fairly quickly change. I want to talk about the positivity number, which we have talked about before. And this is it is a slide that shows number of tests, as you can see, for each day, number of tests. And it also shows the positivity rate, which was at last one was at 4.7. Now I know, we have increased testing, as you can see, and we're very happy that we've done that. We're not where we want to be yet. We got a ways to go, but we've significantly increased testing, and people have done a very, very good job across the state getting those numbers up. The testing is so very important, so we can determine who has it, because many people have it and don't know they have it, do not really have the symptoms. But finding out who has it so that they can be taken care of, and also we can slow the spread of COVID-19 is so very, very important. And I know, because I've gotten calls about it, that some people think, and are wondering at least, if the increased cases that we are seeing is simply because Ohio is testing more. Certainly some of that is due to that. But the experts that we have consulted do not think it is entirely that. So what you have to really look at to make that determination, or to get some idea of whether it's caused completely by the increase in testing, is you have to look at what we call the positivity. Positivity simply is, of all the tests done in a day, what percentage can't come back positive. As we've talked about before, we've been running between 4 and 6%. Not horrible. We would like, obviously, for it to go down, but not horrible. But it's 4 to 6% is what's been averaged. What we have seen, though, that what we would expect to see, we were testing initially very restricted. People who had to have symptoms, people who had to think they might have had it. And as we've expanded it, particularly in the last several weeks, we've expanded to anybody. And so as you expand that beyond the group of people who have symptoms to a much broader group, one would assume that your positivity rate would expect the positivity rate to drop. That would be the normal thing that you would expect, because you're testing not just people who have the symptoms, but also people who have no symptoms at all. That has not happened. It's not gone up dramatically, but it certainly has not. It's gone up a little bit, but it certainly has not dropped, and that would indicate that we are seeing an increase in COVID-19. Certainly in Ohio, the cases do reflect certainly some of that. We talked last week about the two counties in Ohio that we're particularly concerned about, and we remain concerned, kind of on alert, and that is Hamilton County and Montgomery County, Cincinnati and Dayton. In fact, I was on a call with the Vice President today, and with officials at the White House, and they specifically called out those two counties. They talked about a few other areas of the country, but they had a concern about those two. And so they told us that they would give us some additional help in these two communities. We'll talk to General Harris of the Ohio National Guard in a little bit. But his guard has been out, and they're out today doing additional testing. And I know the two mayors, Mayor Cranley, Mayor Whaley, have both been involved, and the county commissioner has been involved in getting additional testing in those two communities. But I want to talk a little bit about the data that we're seeing in these two communities. And I'm going to start with Hamilton County. At the end of May and into early June, Hamilton County was holding steady at an average of 30 cases per day per 100,000 population. As of this week, the average new cases per day increased to approximately 100 cases per 100,000. So they went from 30 to 100. Now, due to the delayed diagnosis, these numbers may continue to grow for this reporting period. So we assume they're not done. By reviewing other healthcare indicators, we can see that this is not solely because of increased testing. For example, more people are visiting their doctors more often and being diagnosed with COVID-19. In 1 week's time in Hamilton County between June 15th and June 22nd, those numbers nearly doubled from 40 to 78 visits per day. Additionally, we're seeing an increase in additional utilization of other healthcare services. In Hamilton County and the surrounding southwestern Ohio region, hospital utilization by COVID-19 positive patients reached their lowest level of this epidemic during the first and second weeks of June. However, as I mentioned earlier, the number of COVID positive patients being treated in standard hospital beds, ICU beds, and on ventilators has steadily increased. In fact, in Hamilton County, the number of COVID positive patients has doubled from a low of 65 on June 11th to more than 130 this weekend. Very, very concerning. Let me turn now, go up north, a little further north to Dayton, Montgomery County. We're seeing some of these same flags when we look at Montgomery County. There's a noticeable increase in cases over the last month from an average of about 10 cases a day at the end of May to about 40 cases a day in the most recent week. The community is also experiencing early signs that more people are seeking medical care for COVID symptoms. For example, outpatient visits grew from an average of nearly 7 visits per day to 27 visits per day. For the hospitals in our west central region, the region that Dayton is in, the number of COVID-positive patients in standard hospital beds, ICUs, and ventilators has also doubled since the first week of June. Doubled. COVID-specific hospital utilization is approaching levels not seen since the earlier peak of the pandemic in April. To make sure we have enough hospital and ICU beds to treat everyone who needs care, such as those who need emergency surgery or in a car crash or suffering from a stroke, we certainly need the help of all Ohioans, especially those in Hamilton County, Montgomery County, and surrounding counties to redouble their efforts to social distance, wear a mask in public, and follow good hand-washing protocols. And again, that is not the only reason that we are concerned. We're obviously concerned about what goes on with our hospitals, but we're concerned ultimately, the most important thing is human life and protecting people. So what we are seeing in Montgomery County, what we're seeing in Hamilton County is not good. We got an alert on, basically, and we'll talk some more about those counties in a little bit.